Hello, everyone. It's so great to finally be here. We've been planning and discussing and debating so long, and now we're here. Mexico has actually happened, and we can start the defining of the actions that we need all to rally around in order to not only have agreements, but also to push and accomplish implementation of gender equality, women and girls' rights. As you all know, we closed the Commission on the Status of Women, this year's version, as late as Friday night. And I think I'm still a bit, I have still that adrenaline from, from the negotiations and the discussions at the Commission of the Status of Women. As you might know, continues always over 2 weeks. And this year was, yeah, maybe I should say dramatic, because it was very difficult to reach an agreement, but in the end there was an agreement. And as many of you know, the battleground, I hesitate to use these words, but the toughest discussions and disagreements between member states is around sexual and reproductive health and rights. And those of you who are here today, and those of you who have prepared today's seminar, you all know that even that concept is debated. Anyway, we did reach an agreement. As you know, it's the countries, the member states who negotiate, so they reach an agreement. But for UN Women, it was extremely important to see to it that we did come out with a document in our hands 1 year after the COVID crisis, when women and girls have suffered so much of the socioeconomic crisis as a consequence of the COVID-19 virus and pandemic. As you also know, women and girls have suffered a lot because of the lack of access, denial of rights, and increasing maternal mortality levels, not least in conflict zones during this year. So this is, as far as I know, the first time that the UN actually safeguards rights for women and girls, also sexual reproductive health and rights, in the context of COVID, the COVID pandemic and the socioeconomic consequences of that. So I think it's extremely timely. I mean, obviously I'm happy we have that outcome, but I know that many of you, not least our courageous friends from civil society and youth organizations, would have liked to go much further. I don't have to speak for you, but I suspect that is the case. So I do believe that it's very important to kind of analyze the current situation when it comes to the debate around these, around sexual and reproductive health and rights. And I think it's very timely to ask for and push for implementation that is so much needed, not only 25 years or 26 years after the Beijing Platform for Action, but also after 1 year with a pandemic and a COVID crisis. So I want to thank you all so much for having prepared the Generation Equality Forum and the specific action coalition on bodily autonomy and sexual reproductive health and rights. Those of you who have, and those of you who have perhaps been engaged in other work, this is your and our work together, and I'm very, very happy to be here. I think it's enormously timely. And as you all know, women's health is a fundamental right within which reproductive rights, sexual rights cannot be separated. And the human rights of women include the right to have control over and decide freely and responsibly on matters related to their sexuality and their individual autonomy and agency, including sexual and reproductive health, free of coercion, discrimination, and violence. So the possibility and ability of women to control what happens to them and to their own bodies impacts their ability to engage in economic, social, and public life, and the terms on which they do so. And the theme of the Commission on the Status of Women this year was leadership and public decision, public leadership in public life and decision making in relation to women's rights and gender. So this all goes hand in hand. If you can't decide about your own body, it's very difficult to be part of decision making, run for office, take part in elections, etc. as well. So gender-related barriers such as unequal social norms, lack of autonomous decision-making and control over financial means, limited freedom of movement and experience, and risk of gender-based violence just has to be addressed. Laws and policies, institutions, investments, and service providers at all levels need to be free of discrimination, bias, and must be protective of women's rights. And as I said, the COVID-19 pandemic has put almost universal pressure on the gains we had in relation to gender equality made since the Beijing Platform for Action from 1995. And COVID-19 has exacerbated existing inequalities between women and men, but also between women in different parts of the world and in different circumstances, and also depending on race, class, sexual orientation, geography, income, many other things. Overstretched health systems often divert resources away from services that particularly women need, including sexual and reproductive health services. We've seen this also this time. And to be able to withstand crisis, obviously we have to invest in universal health coverage now, and we have to put that pressure on those responsible. Social and economic policies and programs which aim to control the fallout of the COVID-19 pandemic must be inclusive and transformative, and again address women's leadership and acknowledge their fantastic work that we've seen this year. As you know, women are in majority of those providing health services to women and girls as well, and they have also been working extremely hard this year. Governments and donors should consult with women's organizations and leverage existing gender equality institutions and mechanisms when carrying out assessments, developing, implementing and monitoring progress and policies related to the COVID-19 response. And we always have to place women and girls in the center of whatever we do in this regard. Encouragingly, global health expenditure is increasing, and with estimates to reach $11 trillion by 2030. And I think the crisis has really put spotlight on the needs for this. We need to ensure that these resources contribute to healthy lives and well-being for all, and that investments are made in gender transformative actions. So a central part, we believe, of this work, and you too, I'm sure that's why we're here today, is the vision of the Action Coalition on Bodily Autonomy and Sexual and Reproductive Health and Rights. And you know that part of the language there says, or proposed language says, working across action coalitions with multiple stakeholders at all levels, we can transform gender and social norms, promote gender equality, applying an intersectional, intercultural, human rights-based approach, and improve sexual and reproductive health and rights outcomes, leaving no one behind. And this vision contemplates that girls, women's and feminist organizations and networks and their allies need to be strengthened in order to advance sexual reproductive health and rights. And we also have to point out that governments are accountable to safeguard these rights. Well, I'm very, very happy to be here today to discuss this also in the framework of the universal health coverage, since it is all linked together. Thank you so much for being here, and I look forward to this session.
Thank you so much, Åsa, for those very welcoming and very somber words. I introduced myself as Leila Beckett, but I didn't introduce what I do for a living. My formal title is that I am the director for Arab States, the regional director DCO, the Development Coordination Office. And that has been my job for nearly 2 years. But for 20 years, I worked for UNFPA, and my heart on sexual and reproductive health and rights sits at the center of a woman who is now 56 and remembers what it is like from 30 years ago, where we were still discussing gender equality. As a woman, as a feminist, as a professional, there is nothing that I can talk to you about in terms of empowerment if you cannot speak about bodily autonomy. And without any fancy words, it is impossible for me to even contemplate how would we begin to talk about economic employment, economic equality? How can we talk about social equality or engagement within the political sphere if a woman or a person, in this case, has no control over the most basic functions and the most basic decisions of her own life? And so this panel is more than just a moderation session for me. It is at the core of what I would consider the fundamental crux of good development. It is impossible that we can marginalize 50% of the population because they have no autonomy or very limited autonomy or questioned autonomy over their basic rights as a person. So whether you are a man or you are a woman, your sexual and reproductive rights and choices are the first things that you learn to control. And without that, it is impossible to engage productively. And as we go forward today, and we have a very distinguished group of panelists, we'll be discussing a number of questions, and we'll get to that in a minute. But I wanted to focus a tiny bit on the COVID response. In any emergency, we tend to blame the emergency for all of the ills and woes. In the case of COVID, it highlighted the fractures of a system that has been struggling for 2 generations, and also was very articulate in her presentation of when we had the Beijing, when we had ICPD, and 25 years ago, we were able to negotiate a set of treaties with member states, the same member states who exist today, more or less, and where we have not been able to safeguard those rights despite all of our actions. So for today's panel, I would say that COVID has presented 2 things. One, it has been incredibly good at highlighting where the fractures of the system are. Social protection, inequalities that have existed, racism, gender bias, all of those were apparent. And in the race for development, where you had multiple priorities, governments were not paying as much attention, especially where we had economic decline. Along came COVID as the great equalizer and provided a platform for us to re-engage governments around equitable social justice, including sexual and reproductive rights as a fundamental cornerstone of development, not just within the health sector, but across the board. And so today, as we hear from a very distinguished panel of 10, we will be able, I hope, to see not only where we can recognize where women's reproductive health and rights interfaces with the development process, but is also considered the cornerstone for good partnership. How do we re-engage amongst the coalition, not only of the like-minded, but for those who have been a perpetual obstacle? And I hope that as we go forward, we will be able to focus on 4 key questions, or 4 key guiding principles, if you will. And as we engage with each of the panelists, I'd just like to set some frames here around what you might want to discuss with us. One is that we know that there are exceptional structural barriers to women's health, physical autonomy, and reproductive rights. What, in your opinion, are those structural barriers that we could focus on and work as a coalition in overcoming? And certainly within the context of the global pandemic, are there measures, and what measures should governments and society take to guarantee the comprehensive rights of health for women? In 2021, it should have been a guarantee already. What is it that we can do, and where do we find the best practices for going forward and taking those examples with us? And are there actual examples from COVID, despite the fact that a pandemic is considered something negative? Can we extrapolate, and can we harvest some of those good examples that can be perpetuated and show governments that when you engage women productively and protect social justice of all of the people who live in the confines of a single country, and certainly across the globe, you are doing not only justice to the individual, but to society and to the world at large. I think that if anything, the Action Coalition is one of the greatest partnerships that could materialize some of those examples and bring them to light much more formidably within the context of the member state engagement. And finally, how can women's and feminist movements contribute and generate concrete alliances with governments to promote the sexual and reproductive health and rights, especially where we have seen a regression in some countries and there have been restrictive and punitive measures imposed on the exercise of the rights of the communities, in particular women and girls. I don't want to take too much of your time, as we have 10 speakers today, but I hope that as we go forward, these are just some guiding questions. Please feel free as you go forward to bring from your own experiences, your own highlights from COVID, and you will have 3.5 minutes per person. So I'm going to ask you to be very firm in the timing. We have someone who's timing us. Keep your interventions short, sweet, and we will have hopefully a lively and engaged discussion as we go along. Without further ado then, let me pass the floor to the first speaker, if you will, Mr. Philippe, forgive me if I pronounce this wrong, Fedelka. Monsieur, the floor is yours.
Thank you very much, Madam Moderator. So I'm indeed the Belgian ambassador to the United Nations in New York, and I represent here Madame Sophie Wilmès, the Belgian Deputy Prime Minister and Minister for Foreign Affairs, who would have really very much enjoyed being with you today, but she had a political emergency in Brussels. So she apologizes and she asked me to read her intervention for her. And I would like to start by thanking you for inviting me and inviting Belgium to your panel. I'm honored to sit today with true advocates of bodily autonomy. In Belgium, we are admirative of the energy galvanized by UN Women, Mexico, and France in this forum. Gender equality, my dear colleagues, and the full realization of the human rights of women and girls are a priority for my country, Belgium, both in our internal and external policies. Access to sexual and reproductive health and rights is an integral part of this. Gender equality is simply not possible without this access. Structural barriers, Madam Moderator just mentioned it, to women's health, physical autonomy, and reproductive rights are numerous, ranging from weakness of health protection schemes to lack of access to the household income. Legal factors are also affecting women's access to health services, in particular to safe abortion. Let us remember that 8 to 11% of maternal death worldwide are still today related to unsafe abortions. This is worse during a pandemic. The lockdown in many countries has severely impacted the access to health services related to SRHR. Women give less priority to their own health. They might stay away from medical facilities due to fear of COVID-19 contamination. It is also the case for antenatal care, and we know how important it is. We commend the work done by UNFPA, and I recognize here my old friend, Madame Keta. Bonjour, Madame. In mapping those best practices and sharing guidelines on how to ensure effective and safe prenatal care in pandemic times. I am sure we will hear more about this today. In its external policy, Belgium applies a human rights-based approach to SRHR. Sexual and reproductive rights are a prerequisite for each person to enjoy and effectively exercise all of their human rights. Belgium pays particular attention to 1, prevention, 2, access, especially for teenagers and LGBTI persons, 3, availability of modern quality contraception, And 4, inclusion of SRHR in universal health insurance and social protection. And I cannot speak, my dear colleagues, about external policy on SRHR today without mentioning the She Decides initiative. Together with the Netherlands, Denmark, and Sweden, Belgium launched in 2017 the She Decides conference in support of organizations worldwide affected by the then US administration defunding decision. We very much welcome the US recent decision to cancel this policy. We welcome it. But this should by no means mean that Belgium will diminish its commitments towards the realization of the SRHR of all women and girls. She Decides has materialized in more funding, of course, and this is important. But She Decides has also created networks of mobilizations at all levels. Those are important for knowledge sharing, peer support, and advocacy. It is in the same spirit that we will actively participate as a commitment maker on SRHR of the Generation Equality Forum. We are indeed worried by the current attacks on women's rights. We welcome the fact that the Commission on the Status of Women could agree last Friday on a consensus text. Women's rights to decide about their own body should be extended and not weakened. Before finishing, Madam Moderator, let me underline that SRHR are also a priority in our internal policies. I wish I would have more time to explain to you the creation of sexual violence care centers in all major cities in Belgium and how these reduce the risk of re-victimization. I look forward to our fruitful exchanges today, and I thank you for your attention.
Many thanks to you, Monsieur Philippe, for that very concise and sobering engagement on SRHR. And I'd also like to thank Belgium for its contribution, not only financially, but politically, to the commitment that puts SRHR at the forefront of the discussion. I hope that we'll be able to come back to some of the points that you raised around gender equality and the interface with health and women's health in particular, and the commitment to She Decides about her body. How are we going to forward that partnership and make the coalitions of like-minded, like we have with the Belgians and the coalitions of many of the member states? We focus too often on those who are the naysayers, but from the engagement that I can see here, we have a huge amount of yay-sayers. And I think, if anything, that this panel is all about how we're going to garner that energy and make it happen. Again, I don't want to take up too much space. Let me pass the baton now to our second speaker. I have Gro Lindstad. Please, if the floor is yours.
Thank you very much, Leila, and thank you all for the invitation to be part of this panel. My name is Gro Lindstad, and I am the Executive Director of Focus Forum for Women Development, which is a Norwegian women's organization working closely with women's organizations in the Global South and also globally. I think that Åsa Regnér said very much about the structural barriers in her opening. And I would just like to, in addition to that, frame it around the fact that when it comes to structural barriers, there's a lack of equality. There are power structures which favor men and boys and not women and girls. And there is the question of poverty. Those are, in my view, seeing and working with this, some of the major structures and barriers that we are up against. In addition to that, the actual lack of decision of our own bodies. And that has been highlighted now during COVID-19, because a number of countries have further restricted women's and girls' rights to decide over their own bodies by hiding it under saying that it's not seen as essential healthcare, which is a paradox, because these are rights and needs that cannot wait. It is a paradox that, as Åsa Regnér said, she hesitates to use the word battleground. I will use the word battleground because that's what it is. It is used politically as a bargain card to trade other issues. And it's a paradox how women's rights are trading cards, and I never see that men's are in the same way. Looking back at where we are now, having just finished the Commission on the Status of Women, and I've been following this for 2 weeks because I've also been on the official Norwegian delegation, even though it's all been virtual. But it's been interesting seeing how member states are still struggling to come up with agreed conclusions, and the fact that we're struggling with the same issues as we almost did 25 years ago. I was in Beijing in 95, and I've carried with me the Beijing Platform of Action as my Bible for these years. And it's a paradox to me that we're still fighting to keep history, and we're fighting to get to a status quo instead of making new politics for the future, which we should be doing. So every year when we're doing agreed conclusions, we're settling on keeping the language that was already there 25 years ago and seeing that things have actually tightened. So what do we have to do? Well, from a government side and in negotiations, in any minister who is doing something internationally, gender equality has to be among the top 3 talking points in bilateral talks and also multilaterally. If they are not, and if this is not on every list, we're not going to achieve the Sustainable Development Goals by 2030. It has to be upfront and it has to be a priority. As you said, Leila, with 50% of the world population urging for rights, it's Pumzila said once, you can't win a soccer match if you have 50% of the team on the bench. And this is what we're talking about. So lastly, I'll just say one thing, and that is, at this point, the sexual and reproductive health is something that is in many ways acceptable to a number of member states, but the rights is the issue where the fight is. The rights are under attack, and it is a battleground when we come to rights. And if we're going to change this, it has to be changed with governments and civil society as a coalition. Civil society has to be let in. We have for too long been sitting outside the meeting rooms, outside the negotiations, and there's a lack of transparency. I can say that I'm lucky in Norway because I've actually been included in the official delegation for a number of years and have been able to actually give input. But I also see that I'm one of the lucky fews. There should be so many more. And with that, I'll say thank you. And I look forward to the discussion.
What a very thoughtful intervention, Gro. I think you raised a number of important points, not the least of which is that with human rights under attack globally and sexual and reproductive rights at the center of that, there's nothing that strikes fear into many governments as the rights of women, particularly around their sexuality. And the regression on that is something that not only needs to be safeguarded, but reinvigorated, particularly with civil society. I couldn't agree with you more. And I think as we go forward, it is important to keep in mind that with the pandemic, greater securitization and acceptance of a security modality of governance as opposed to a democratic one or an engaged civil society is something that we need to also consider. That within the package of human rights, where women's rights sits firmly in the center, it's important that we look at the totality of that human rights discussion and see where we fit within that. I'm going to hand over the floor now to SMA Josephine, please, if the floor is yours, please. And again, 3 to 4 minutes maximum, if I could please ask you to keep that limited. SMA, over to you.
Yeah, thank you very much for having me here. My name is SMA Josephine, and I am a sex worker from Nigeria. Oftentimes we talk about access to universal health coverage and access to human rights protection. But sometimes I ask myself if sex workers was actually put into consideration when all these policies development were made. Because looking at the structural barriers to sex workers' access to SRA services, I will confidently say today that the indirect and the direct criminalization of sex workers is one of the greatest barriers to their access to SRA services. It's also a structural factor to violation, discrimination, and even HIV transmission. Additional laws such as those related to HIV exposure, non-disclosure, and sodomy has further prevented sex workers from accessing healthcare services. The criminalization of sex work have also created an environment that becomes very hard for one to address the issue of lack of access to funding of SRA services that accommodate sex workers. When we look at the structural barriers that affect sex workers, we look at the taboos, the social taboos, the traditional and religion that discriminate sex workers. These have actually linked that the government, especially in Africa, don't even have the capacity to fund universal access to SRA services for sex workers. And this is something that creates a lot of issues when it has to do with program planning and services for sex workers. You have the segregated services when sex workers don't even access SRA services in one particular place. They have to travel to a lot of distance just for them to access different kind of services. And all this are all because of the criminalization of sex workers, where sex work is not given the opportunity to exercise their right on what happens. We don't often respect the choices of sex workers just like we respect other professions. And looking at this, I think it's really time for our government to commit full decriminalization of sex work. The government should be able to develop and implement policies that create an enabling environment that accommodates sex workers' access to SRA services. Our policies should be able to improve the access. The truth be told that there are significant research that actually stated clearly that decriminalization of sex work reduces HIV infection among this population. But oftentimes policies are made and sex workers are not included. Looking at the COVID-19 situation, sex workers were mostly affected because they don't work anymore, they don't earn income. But yet, governments still provide loans and other palliative supports that sex workers were never part of. They provide loans given a lot of policies guiding those loans that sex workers cannot even access them. They keep unrealistic requirements that sex workers can't even access. These are a lot of issues that has to do with structural barriers that our government needs to start looking into. And one of the reasons that these things happen in our countries, especially in Nigeria, for example, where I come from, you find that the sex workers have to rely on PEPFAR and Global Fund that provide free access to HIV prevention and treatment services for them to have access to these services, which is not supposed to be like that. I think it is important when we make policies, when our government make policies and commitment to universal access to healthcare coverage, make access to human rights protection, sex workers should also be considered because it is their right as women. And as well as transgender sex workers, there is need for our government to look into the traditional social norms that discriminate transgender sex workers, those that are not able to conform to the society or what they want them to be. So looking at the current pandemic, there's a lot of need for us to look into our programming. There's a lot for us to create services that is central, where sex workers can have access to it, and not make it disgraded that they can't even have access to those services. And I keep asking, if those services are there and sex workers can have access to it, why? They are, first of all, they are human, and they are also citizens of each country. So I think it's proper for our policies to look into all that. Thank you.
Very well said, SMA, and I think you raised some of the key issues around what does inclusive policy and inclusive planning and implementation and access not only to services, but social justice on the whole. You raised a number of structural barriers that were around the legislation and criminalization of sex workers, but more importantly, where social norms interface with that and where discrimination comes into play. So all the way from individual choice to inclusive planning, access to service and social justice. And then when you have the opportunity to make that choice, what other opportunities might a sex worker have access to in terms of getting out of sex work or making her own free choice or his free choice? I think you raised a lot of also good issues around what is the gender divide? We focus disproportionately on women and girls, but there are other issues around gender norms where transgender and individual choice are also important. Thank you so much for that intervention. You've given us a lot of food for thought and that to take forward. But now we have Karina Gould from Canada. The floor is yours, please.
Great, thank you so much, Leila. And I'm really pleased to be joining all of you today on such an important topic. But I guess I'm also really frustrated to be here as well, because I think, as Gro said so eloquently, we've been having the same debate for going on 25 years now. And isn't it time to move this debate forward and stop using the same language or even seeing a regression in the rights of women right around the world? I often think about the irony of 2020 in that it was supposed to be the year of generation equality, but it ended up being the year of the she-cession. It ended up being the year of seeing, the rollback of women's rights in so many places around the world. And I'm hopeful that 2021 will be the year of the she-covery, and it will be the year that we actually move this agenda forward in a really positive, tangible, and sustainable way. I think Leila said it best in her opening remarks when she said there is no gender equality without bodily autonomy. And so when I think about what the key structural barriers are for women to be able to access their health rights, it is the denial of rights. It is sociocultural norms that see women as less than equal. It is the structures that are in place and the power dynamics that make it so that it is harder for women to access their health rights, and particularly their sexual and reproductive health and rights. I'm very proud on the one hand that Canada has a feminist international assistance policy, that we are front and center in advancing gender equality, and that we are loud in all forums on advancing SRHR, that we're a top donor in the OECD when it comes to gender equality and one of the top donors on sexual health and reproductive rights. But we don't really want to be that lonely. We want others to be part of that as well, because as one of the previous speakers said, we need to be talking about gender equality in all instances, because it is about advancing all of humanity and creating societies that are more equitable, that are more just, and that are more inclusive. One of my local women's rights activists here in Burlington in Canada, where I'm from, said to me, women are not projects. We can't see them as, you know, one-offs here and there. Actually, we need to see them as whole beings who are multidimensional, who have complete lives, and we need to respond to that completeness. And I think that you cannot talk about economic empowerment. You cannot talk about creating a more inclusive or educated or stronger country and community if you're not talking about sexual health and reproductive rights of women and girls and gender diverse people. It is not something that you can do one without the other. It has to go together. And if I can just say that one of the things that we have to do and that we've learned from this pandemic is that you have to include women's rights organizations. You have to listen to them. You have to hear what they're saying, because they are on the front lines and they see what is happening in community and they see what is happening to women. And they are our best allies and our best resources when it comes to making policy and plans that are going to respond to the needs of women and gender diverse people. And we have to include their work as an essential service. Women's health has to be included as an essential service. Sexual and gender-based violence prevention programs and responses have to be included as essential services, because when they are not, women suffer, women lack access to justice, and they lack access and autonomy over their bodies, and that has an impact on them and their entire communities. And finally, I'll just say that we have been so proud to stand side by side, to walk down the path in allyship and solidarity with women's rights and feminist organizations around the world. And that has been never more important than in the COVID-19 pandemic, to hear from them, to hear what they are seeing on the ground, to support their courageous, bold, and brave work that they do. And that's something that we need to continue to do. We need to support each other as feminist movements. We need to lift each other up and amplify our voices. And in terms of how the women's rights and feminist movements can work with governments, it's to recognize when good work has been done, but to keep pushing us in a way that's going to ensure that we're going to keep expanding access to rights right around the world, including in our own countries. We are so fortunate to have incredible civil society partners that are bold and courageous and working every single day to create a more inclusive world, one that sees women reaching true equality and achieving true potential in all of their diversity and in all of those multidimensional spheres in which they occupy. Thank you.
Thank you so much, Karina, for that intervention. I'm just taking note of some of the main points that really struck home with me. That if women are not seen as an equal and autonomous, it is impossible to engage on a discussion about development or engagement in any movement. And that was the second thing that also struck me, that rather than the initiatives that we've had and the examples that each one of us can probably cite, this discussion is more about how do we draw on the collective good here and reinvigorate that movement that was the crux of the feminist revolution, if you will. I mean, I'm 56 years old. You've got to forgive me if I speak about days gone by. But in some ways, I feel more empowered and part of a movement than many of my counterparts who are women and men of this generation. And I think that you raised some very interesting points around the partnership and how do we translate this back into a movement. They say that all it takes for bad things to happen is for good people to sit on the sidelines and watch. And perhaps over the last 25 years, as we've seen the regression, it has been because each of us in our own right has been trying to do good. But this is about a collective movement now, in order for that slippage to be put on hold, and we can move back from that regression, hopefully. Anyway, enough of my speaking. Over to UNFPA's Deputy Executive Director and a very good friend and a pleasure to have on this panel, Madame Diane Kieta, the floor is yours.
Thank you so much, Leila. Excellencies, Monsieur l'Ambassadeur, Honorable Ministre, my dear Osa, and all colleagues and friends. I'm so happy to be here. You know, after Osa said, there is not much to add. We are the duty bearer and we'll work towards that. But it is a chance to have the feminist organization on this panel and a greater chance to have the member state as well. It is important. We are coming a long way. She decides, the ambassador of Belgium mentioned it. It was so revolutionary at that time. And let me paraphrase the Prime Minister of Belgium, le 21e siècle, le siècle de la femme. This is the century of women. He said it so well, so well. You go from there, you have those country member states who take the feminist policy as a way to go forward. Sweden, Canada, and make it happen. This is a lot. While they do that, the civil society is working hard, working to make a difference. So what we do as a UN, we are here to support the mandate that the member states have given us. And the civil society is exactly out there, you know, to help us get everywhere up to the community to make it happen. So having this kind of panel here is just where we need to go. Gro said it so well in saying that is our battleground. How do we transform the battleground in a playground? In a playground where all the harmful practices become the good ones. In a playground where we teach girls. Girls are the future moms of tomorrow, so that they can raise the right boys for positive masculinity. How do we get there? This is the forum for that. You know, I'm not here to say we have 90% of this or that. No need to do it. And the other fact is almost 90% of the country around the world have all the text, the legislative part of it. But how do we implement them? How do they hide behind their desks and not to do it? That's what is, you know, confronting us. And this is why the Generation Equality Forum is so fantastic, because we are going to walk the talk thanks to the member state. Member state, each of you take one developing country and go together, because you give resources bilaterally as well. And civil society, we admire you. We stand with you to help us fulfill the young girls' mandate everywhere. I would like to take the opportunity to thank all the countries who signed last May the statement to protect women and sexual reproductive health and rights under the COVID pandemic. It was held on the South Africa and Sweden government. I was then minister. I had the privilege to sign that. But this is something that changed the world. Thank you for doing that. And let's continue doing that. This, for me, it is absolutely, absolutely key. Now, what is there for us? You know, it is more bodily autonomy. Leila said it very well, but bodily autonomy is the first right among the rights. If you cannot wake up in the morning, make sure that your body, you can decide what to do with it, there is a problem. So how do we work with that? How do we work with community leaders, religious leaders, to make that shift, that change of norm? That's, I think, as a co-lead for bodily autonomy, we hope with the member state and the support of civil society, we're going to get there throughout this year, just like it has started a long time ago, to go slowly but surely. Some of us need to make the noise and need to take the flags and go out. Some of us need to work with government, with leaders, to explain to them, because lots as well, it's about knowledge. It's about capacity to understand what we want them to change. And we need to go. There is so much pushbacks. We don't sleep. Osa doesn't sleep, I don't sleep. Every day in a part of the world, there is some country we just want to do BAM, and we go all the back again. So really, I'm happy to be here. I won't take much of your time, but we are grateful for this. We are so grateful. When I say Darren sitting there, contraceptive, if we don't have the supply, nothing will happen. If you go to take France, if Miss Coca has not happened, the partnership for Ouagadougou will not have happened. So, you know, let's don't, because of the past, we can talk about, we can have Asemi Josephine here today. We can talk about LGBTQ today. So let's continue the movement. Let's continue the work together, and together we'll make it. Let's transform the battleground into the playground where young girls and women can learn and government can learn. Some government members need to learn. They need to learn. That make a difference between developing country and developed country, maybe. This is the truth I'm talking here. So thank you, happy to be among you, among partners. You don't have to convince to continue the hard work. Merci.
Merci à vous, Madame Diana, also. That was a very thoughtful engagement as always. Again, I like the idea of having a whole of society approach to better understanding sexual and reproductive health and rights. And what does bodily autonomy mean, not only for the individual, but for the society on the whole. And the second thing that was very important in that I really liked in your intervention was the fact that governments take signals from each other. If governments take negative signals from each other and start to change their legislation and are empowered from that, it is the mandate and the obligation of the like-minded who are in this group, in this panel today, to bring together a coalition of the like-minded, if you will allow me that, that terminology, and ensure that those positive signals are also transmitted, if nothing else, as a counterpoint to all of the negative engagement that has taken place over the course of the last 3 decades. Moving on to our next speaker, we have Cecilia Merchant. Cecilia, the floor is yours, please.
Buenas tardes, qué gusto tan grande para nosotras poder estar en este encuentro. Mi nombre es Cecilia Merchant. Soy secretaria de Políticas de Igualdad y Diversidad del Ministerio de las Mujeres, Géneros y Diversidad de la Argentina. Y creo que es muy interesante poder intercambiar entre nosotras, entre nosotros este momento, porque justamente la posibilidad del encuentro entre las organizaciones, el movimiento feminista, LGBT y los gobiernos es yo diría que más que una alianza central, es una necesidad absoluta para poder avanzar en nuestros derechos. En la Argentina particularmente, ustedes saben que tenemos un movimiento feminista muy extendido, muy potente, muy diverso en todo nuestro territorio y que lleva años de despliegue, de lucha, de debate, de instalación de temas y de conquistas. Todas estas conquistas se van dando y se va pudiendo avanzar cada vez que tenemos gobiernos populares en nuestro país y cada vez que logramos justamente esta alianza entre este movimiento y los gobiernos. Particularmente este año, nosotras hace un año, en diciembre del año pasado, se creó el Ministerio de las Mujeres, Géneros y Diversidad. Y creo que es importante referir a que el ministerio es parte de las políticas públicas que son conquista de este movimiento de mujeres, lesbianas, travestis y trans que se da en nuestro país. Apenas se creó el ministerio, inmediatamente entramos en la situación de pandemia y aislamiento, y como ustedes dijeron, este aislamiento generó con claridad, o mostró con claridad, las enormes desigualdades que se viven en nuestros países por cuestiones de clase, por cuestiones étnicas y por supuesto por cuestiones de género. En ese contexto de creación de nuestro ministerio tuvimos como un abordaje inmediato de las violencias por razones de género, Nuestro ministerio destinó allí muchísima de su energía. También destinamos mucha energía a todo lo que tiene que ver con los trabajos de cuidados, que nos parecía central en este contexto de crisis de los cuidados, y en abordar también alguna población muy olvidada y muy lastimada en nuestro país, muy vulnerada en sus derechos, que es la población travesti y trans. En esa emergencia abordamos estos 3 puntos como ejes centrales, pero nunca en todo el año nos olvidamos de seguir batallando por justamente algunas demandas de nuestro movimiento que son históricas, como por ejemplo la legalización del aborto en la Argentina. Y logramos a fin de año, además de haber construido desde el Ministerio un plan de acción contra las violencias por razones de género, haber construido un presupuesto con perspectiva de género a nivel nacional, haber logrado construir un plan de igualdad en la diversidad que pronto vamos a contar, a anunciar en nuestro país. Haberlo construido con la participación de las organizaciones fue fundamental, como fue fundamental la participación de todas las organizaciones y el movimiento, particularmente la campaña por el aborto legal, seguro y gratuito en nuestro país, fue fundamental para esta conquista que se dio a finales del año pasado. Esta conquista que vino de la mano, fueron 2 proyectos de ley, uno que garantizaba el acompañamiento y de las mujeres y las personas gestantes que deciden interrumpir un embarazo, que el Estado pueda acompañar a estas personas, como así también a todas aquellas mujeres y personas gestantes que deciden avanzar en un embarazo, creando otra ley que es llamada la de los 1000 días, que garantiza los derechos para la buena nutrición, para la salud integral, tanto de la gestante como del niño o la niña hasta los 3 años. Creo, para utilizar muy bien mi tiempo, decir que nos sentimos orgullosas centralmente de este intercambio, de esta permanente acción e interacción entre las organizaciones de mujeres, LGBT, feministas, y nuestro Estado, que es un gobierno que tiene como bandera las causas populares, las causas federales, las causas que tienen que ver fundamentalmente también con la justicia social, y en ese sentido ha incorporado la mirada de los feminismos, la lucha por la igualdad de género como una de las banderas centrales de las políticas públicas de nuestro gobierno y de nuestro Estado.
Madam Minister, thank you so much for that intervention, particularly around legislation. If I could ask you please to mute your microphones if you're not speaking. There's an echo. I would like to thank you so much for your intervention, particularly around the legislation and the importance of inclusive gender planning, having that legislation in place, and in incorporating as much diversification as possible. I think that when we talk about what is a protective factor, having diversity, and this is a very diverse group, having that inclusiveness and the diversity of the opinion is one of the things that is also a protective measure, particularly against regression. The more diversity that we have and the more engagement from sectors of society, from different counterparts, from across the globe, that will be the strongest pivotal point that we have. I'm reminded that we are very short on time and we're only halfway through the speakers. May I please ask a plea to everyone who is speaking to limit their engagement to 3 minutes, or we will run out of time and then it'll be my head. So with that, over to you, Audrey, for the intervention. The floor is yours.
Thank you very much, Leila. So I'm Audrey Fontaine. I'm a member of the Gender Equality Youth Task Force, and I'm a medical doctor working in France. Before starting, I'd like to thank the organizers and the partners for this crucial and major event, and to invite me to speak on this fundamental topic. It's fundamental because sexual and reproductive health rights are human rights. and they are part of universal health coverage. They should be guaranteed everywhere in the world. However, we are very far away from it. Every year, millions of women give birth without any professional support. Millions do not receive the required care, and millions die. The COVID-19 pandemic, as we said already, worsened the situation. We sadly saw that in time of crisis, bodily autonomy is one of the first rights to be threatened. Barriers to SRHR are various: legal, regulatory, cultural, financial, geographical, but also health systems are weak. Health services are fragmented. Human health resources are lacking. Health policies are not taking into account specificities of some populations, and financing is unequally distributed and unsustainable. All this leads to lower access and lower quality of healthcare, with a dramatic effect on the most marginalized communities. What to do to change this? Well, we need to reinforce health systems to guarantee affordable and quality sexual health services to all. We need to invest in human resources for health and engage in transformative leadership. Women represent 70% of health and social workforce globally. Most of us are working in lower status, low-paid roles and low-paid sectors, and we often work in insecure conditions. Ensuring female health workers decent work is central to guarantee everyone, everywhere, affordable and quality services. We also need to take an intersectional and global approach to identify the groups of women with the worst health outcome and reach out to them. We need to address the gender-based determinants of health and other determinants such as climate, economic, and social inequities that affect women more strongly than others and make them less able to afford care. We also need to transform the social norms to fight stereotypes and promote good practices through education. Countries need to incorporate access to sexual education and sexual health and reproductive services in their national priorities, including access to contraception, safe abortion, and to services that respond to the needs and health patterns of the most marginalized communities: women, young girls, LGBTQI indigenous communities. We need sustainable financing, and we need to harmonize health investments toward all aspects of SRHR. To conclude, I will quote Dr. Tedros, who said that health was a political choice. SRHR are fundamental parts of health, and to achieve equality and leave no one behind, we need strong, continuous political commitment to create legal, regulatory, and political environments that would enable the achievement of SRHR and be responsive to people's needs. We need multi-stakeholders mechanism and strict follow-ups. We need to engage society as a whole in the healthier and equal world. And I look forward to the work of the Action Coalition at global level, but we also need the same movement of transformative co-leadership and co-creation at national and local level. And that's how we will act for equal. Thank you, and back to you, Leila.
Well done, Audrey. 3 minutes on the nose, and a lot of food for thought in there. I think if I could pull out anything that's critical from what you were I'm sorry, there's still an echo. Thank you. One of the most important characteristics that you've highlighted is that where health systems are weak, women are the first to fall off the agenda on health. Where financial crisis hits, then the money stops flowing for women, including on SRHR. And if we can emphasize the qualitative information around the social determinants of health, including those that are positive determinants where women are engaged and can enjoy a healthier life and a healthier family, a healthier society, that can be a strong driver of change, hopefully. I also look forward to the Can you hear me now? Sorry, I think I inadvertently muted. Without further ado, then, may I pass the floor, please, to Darren Welch from FDCO, I believe. Darren, I can't see you. Oh, there you are.
Can you see me now? The video should be on.
Yes.
Hi, good evening
And
from...
please ask anyone who's not speaking to mute. There is a terrible echo.
Okay, sounds fine to me. Can everyone hear me? Great, okay, I'll go ahead. So thank you so much for inviting me in the UK to speak at this event, and congratulations to the leaders of the Action Coalition. The Canadian Honourable Minister, I hope you're not feeling too lonely, because I think this panel shows there are lots of people prepared to stand up and make the case with you, and the UK is proud certainly to do that. We have a strong record, as you know, of defending universal access to comprehensive sexual and reproductive health and rights. And we do that for a number of reasons. One, obviously, as we've discussed, it's essential if we are to meet the SDGs, SDG 3 and 4, but all of them, in fact, is critical, but also because it's a very strong expression of our values. As others have said, this is a contested area. I was very struck by the remarks of the Belgian ambassador. We too are shocked by the attacks on women's rights. We raise it in all of our interventions globally. We are currently, as G7 presidency, we have a Gender Equality Advisory Council, something I know our Canadian colleagues did. We're making this central to our policy making and our international engagement. And we champion those issues which others find quite difficult, like safe abortion, like female genital mutilation, and the needs to embrace and bring key worker or key populations rather into the provision of services for those living with HIV and AIDS. So the UK will continue to be a strong advocate of these efforts and a supporter of the work. And we think we're making some progress. We're optimistic, but we know there is still a long way to go. And the COVID-19 pandemic, of course, is risking decades of progress and hard-won gains towards fulfilling SRHR. I'd like to say a few words about the structural barriers, because if we don't address those, if we don't get that bit of the picture right, then we won't be effective across the whole of this important agenda. And there's 3 points I want to make. I know we're short on time, so I'll be brief. First of all, in addressing these structural barriers, we know much of what it is that we need to do. We need to break down the silos in development and get to the root of the structural factors themselves. And that means addressing the exclusionary laws, the policies, and the economic factors which breed exclusion. We need to address the barriers which are created by harmful gender norms and stigma. Again, I'm reasonably optimistic, although we haven't seen the progress we would like to make, about the pace at which social change can and does happen. And I think we should remember that. And we need to address the discrimination that women and girls experience on a daily basis, and the way that communities, families, societies sometimes do not properly value their women and girls. So that's the first thing. We know what we need to do, or a lot of it. We now need to have action. But as we do this, we must focus on the most marginalized, particularly addressing the areas where inequalities come together. So poor rural women, lesbian or disabled women are much more likely to face barriers. We know that, and these are exacerbated by the pandemic. And I thought that Seme's comments were particularly powerful on the experience of sex workers in Nigeria in this regard. So we know what we need to do, or a lot of it. We must do it in a way that focuses on the most marginalized, because that's how we'll get it right for everybody. And then finally, we need to do it together. Donors, we've heard a lot about donors and country governments. We can bring diplomatic engagement, pressure, persuasion, and some resources. But that's got to be a basis for this broader coalition. And that's why we're so excited by the work of this Action Coalition. We know that collaborative action and alliances is how we'll be most effective. It's how we'll achieve that transformational change that we need. And we've got clear evidence that women's rights organizations and locally driven women-led organizations can be key to creating sustainable change for women's rights and SRHR. So we need that partnership, governments, civil society, youth groups, businesses. It's why we're so excited about the work of this coalition. And as we go forward, you can rely on us in the UK to continue and champion all the work that you're doing. Thank you.
Thank you very much, Darren, for a very precise and thoughtful intervention around those 3 points. I think you make some compelling arguments around how to break down the silos, the engagement around the SDGs, where SDGs 3 and 4 are central to the discussion around the remaining 15. And I honed in, and I'm going to paraphrase here, so forgive me if this is incorrect, but taking the sting out of what people generally consider to be quote unquote sensitive is something that I hope that this group will do. There is no topic that is sensitive. We make it sensitive. And if anything here, the fact that if we perpetuate the idea that sexual and reproductive health and rights is a sensitive issue or a woman's issue, we are doing all of ourselves a great injustice. So I hope that that's something that also that the coalition will look at much more formidably. We're very short on time, and with that, I'm going to turn it over to Teresa Alarcón, please, for her intervention. The floor is yours. Teresa.
Muchas gracias. Es muy emocionante estar en un panel con todas estas personas. Fundamental, ¿no? para nuestra memoria, esta memoria relativamente corta de la lucha por nuestros derechos, considerando todo lo que hemos conseguido, ¿no? En siglos. A 25 años de Beijing, creo que se van reafirmando los compromisos en relación a los diálogos y los mecanismos de concertación global con la participación de la sociedad civil y entre todo con la participación significativa de las personas jóvenes, ¿no? Soy parte del colectivo Rebeldía. Esta es una organización con base en Bolivia, en Sudamérica, en la que trabajamos desde el primer momento y hace 26 años por la autonomía de nuestros cuerpos, por las libertades sexuales y la justicia reproductiva. Y nos articulamos a nivel nacional y regional por la lucha por el aborto libre, legal, seguro y gratuito, posicionándolo como lo que es, ¿no? Un derecho para las mujeres, un asunto de salud pública, de salud integral y de ejercicio de nuestra ciudadanía y de democracia, por supuesto. La COVID-19 ha evidenciado la desigualdad estructural, ¿no? Ha recrudecido lo que para muchas de nosotras ya era evidente hace muchísimo tiempo, que es el agotamiento de un sistema social, económico y político que no tiene otra agenda que no sea la de la privatización de todo, ¿no? Incluida la vida. El neoliberalismo ha demostrado una vez más no ser el camino para alcanzar vidas dignas, para alcanzar vidas felices, y aún, sin embargo, nos encontramos con resistencias, ¿no? No es posible no asociar esto a las relaciones de poder entre géneros que se ha comentado ya en este panel, ya instaladas, y para esto, para poder reconocer esto es fundamental romper con la idea de entendernos a las mujeres como únicas, ¿no? Como un sujeto hegemónico que vive una misma realidad, y dar cuenta precisamente de las opresiones sistemáticas, entre ellas también las de carácter colonial, particularmente para la vida y la situación que vivimos los países del sur global, ¿no? Parte de estas resistencias que mencionaba están en los núcleos mismos de los grupos ultraconservadores y fundamentalistas, antiderechos, y esto fue muy notable durante la época de pandemia y de confinamiento. Muchos países vivimos varios meses asediados por políticas que estaban más bien alejadas de la atención de la salud pública y estuvieron enfocadas más bien en reproducir narrativas e invertir recursos en la represión y en manifestaciones de carácter religioso, y hablamos de países laicos, ¿no? Por supuesto, con gran repercusión en áreas claves, ¿no? Como la prestación de servicios que se vieron interrumpidos, los servicios de aborto legal, de interrupción legal de los embarazos, de dotación de métodos anticonceptivos, de medicación para la población que vive con VIH, y también afectando la atención a sobrevivientes y víctimas de violencia. Se ha vuelto más urgente que nunca avanzar en garantizar plenamente la autonomía de nuestros cuerpos, nuestro cuerpo, reconociéndolo como el primer territorio que habitamos. Nuestros movimientos, los movimientos feministas, cada vez más diversos y más plurales, como lo comentaban igual anteriormente, ha hecho aportes importantísimos, ¿no? A nivel teórico y a nivel de práctica y de lucha política, y está demostrando definitivamente que sin feminismo, sin nosotras, sin las mujeres, no es posible construir sociedades con justicia social, ¿no? Ese es el aporte de la interseccionalidad y de los diálogos norte-sur que se hacen cuerpo en las coaliciones de acción. Yo solamente quisiera terminar con una última idea que tiene que ver con el derecho a cuidar. Eso, percibir los cuidados como un derecho. El derecho a cuidar, a ser cuidado, a autocuidarse y a no cuidar, ¿no? Esto incorporado a sistemas integrales de cuidado, en las que todos, todas, todes y el Estado asuman responsabilidades, ¿no? Percibir eso, los cuidados como derechos, considero que contribuirá enormemente a esta agenda de recuperación de la pandemia, y la redistribución, y claro, esta redistribución social de los cuidados, que es lo que se construye a partir de esto, aporta pues a nuestra lucha, que es una lucha en contra de la privatización de la vida, ¿no? Es una lucha por la vida, por vidas dignas, por vidas más libres, más felices y por supuesto más placenteras para todos y todas.
Many thanks, Teresa, for that thoughtful intervention. You raised issues around human rights. Again, we see a recurrent theme here where sexual and reproductive rights as part of a package of human rights, and putting a stopgap around that in terms of increasing politicization, a movement to the right, and regression around social justice. We have two more speakers, and I'm acutely aware of time. So again, please, if you could limit the intervention to 3 minutes. I am going to hand the floor over to Aida Garcia, please. Aida. You're muted. Madame Aida, the floor is yours.
Sí, buenas tardes. Buenas tardes. Agradezco la invitación. Muchas gracias, Laila. Y soy Aide García, de Católicas por el Derecho a Decidir México. Bueno, pues la pandemia de COVID-19 nos impone a tomar en cuenta las afectaciones que ha tenido en la salud de las mujeres y sobre todo en sus derechos sexuales y reproductivos. Su agudización en las barreras estructurales ha impedido alcanzar los objetivos trazados en los programas nacionales, así como los compromisos adquiridos en los acuerdos internacionales. Se ha afectado el acceso a los servicios de salud sexual y reproductiva, ya que la infraestructura es insuficiente debido a que muchos hospitales y centros de salud se han convertido en atención especial al COVID. Las desigualdades económicas y sociales se acentuaron. La violencia de género es incontenible. La educación integral en sexualidad es restringida y el reconocimiento del ejercicio de la autonomía y los derechos sexuales y reproductivos como fuente de bienestar no se han logrado. De igual forma, el estigma por parte de profesionales de la salud que mantienen visiones conservadoras alrededor de la salud sexual y reproductiva, incluyendo el aborto, la violencia obstétrica, así como el acceso a los métodos anticonceptivos, son factores que impiden que las personas se acerquen a estos servicios, lo que impacta negativamente en el ejercicio de la autonomía de las mujeres y jóvenes para tomar decisiones en libertad de conciencia. El Observatorio de Género y COVID-19, coordinado por GIRE, hizo algunas recomendaciones al Estado mexicano. Promover la telemedicina como una forma para garantizar el acceso a anticonceptivos, al aborto seguro, evitando así la saturación de servicios en los servicios de salud. Garantizar el acceso efectivo al aborto bajo los supuestos permitidos por la ley y el cumplimiento de la NOM 046. Despenalizar el aborto en todo México para eliminar las barreras geográficas de acceso restrictivas y discriminatorias que han aumentado a causa de la pandemia y garantizar la implementación de los servicios en todo el país. Una recomendación esencial para lograr los cambios transformadores necesarios es fortalecer el diálogo y la colaboración entre gobiernos y organizaciones feministas y de mujeres. Los gobiernos deben reconocer la experiencia de las organizaciones y fortalecer los espacios de participación ciudadana. Y tienen el deber de no criminalizar la exigencia de los derechos de las mujeres. De igual forma, fortalecer marcos jurídicos laicos para combatir el estigma alrededor de la sexualidad y la reproducción. Finalmente, queremos destacar el papel de la ética pública laica como un código de acción en tiempos de emergencia sanitaria, por el cual todos aquellos que formen parte del andamiaje estatal deben conducirse de acuerdo al cumplimiento de los derechos y libertades y no de sus creencias o moral personal. Muchas gracias.
Thank you so much, Aida. That was very thoughtful. I took note of your intervention where you highlights the impact on women's health, where, again, where health systems are overwhelmed, women are the first to fall off the agenda, where we have obstruction of national agendas as a result of that marginalization of women, and where the legislation around decriminalizing anything that has to do with bodily autonomy is key to the feminist movement and this particular coalition. We have one last speaker, and regretfully, we will not have time for any Q&A, I'm told. I'm very sorry. I'm a good listener, less of a good moderator, obviously, with this panel. So with that, I'm going to give it over to the last speaker. Pauline Faith will be wrap it up, and then we will have 1 minute before we have to close at 1 p.m. sharp. Pauline, over to you. Madam, you're muted. You're muted. Could you unmute your microphone? Thank you.
Thank you. I'm very excited to be here today, especially to discuss a topic that is dear to my heart. And I want to appreciate the leadership of the Generation Equality for the invitation. Many of our speakers have already mentioned the barriers and challenges as it relates to the sexual reproductive health of girls and young women. So I will waste most of my time on that. They mentioned some of the challenges, which include child marriage, FGM, the issues of diversity and inclusion, issues such as safe abortion. But I would like to throw a highlight on women political participation. Looking at policies and legislation preventing women political participation and leadership. The role of women political participation and leadership cannot be ignored as we continue to advocate for the sexual reproductive health and rights of girls and young women. For example, in the political context, the legislation seeking 30% representation have been denied by the Liberian legislatures. These are just few of the many obstacles women facing. And I want to use this time to call on world leaders, state actors, to ensure that government implements or introduce laws and policies that promote women political participation and leadership. In the wake of the COVID-19 pandemic, teen-age pregnancy, gender-based violence continue to be on the increase. Government and society need to ensure the protection of women and girls at all times, including during crisis. There is a need for contraceptive and youth-friendly clinics or hospitals and comprehensive sexual education. I still feel terrible about my friend death due to an unsafe abortion. Many girls continue to die from self-abortion while government play politics and poor culture about human lives and the right to health and protection. Lastly, I'd like to suggest that we start to leave advocacy for free sanitary pads for adolescent and school-age girls. We are celebrating the use of free condom every year, while girls in poor communities drive from school due to menstruation and sometimes could not return back to class. I wonder why priorities are issues about sex that is a choice, the menstruation hygiene that is a nature and should not be a taboo. Ladies and gentlemen, having sex is a choice, but for menstruation, it is not an option. It is in nature, and it is in nature and should not be a reason why girls should be denied rights to education. Menstruation is a must and free sanitary pads should be a must. It should not be put up for debate, but it is a right and that right should not be denied. I want to close and say quality healthcare and services for all is urgent and need a serious approach. Thank you very much for having me today.
Wonderful. And with 1 minute to spare, let me thank you all very much for that last intervention, for 10 enthusiastic, absolutely wonderful speakers. I'm a strong feminist, as I said, but I feel re-enthused by the group. And in the time when we can all feel overwhelmed, it was amazing to be a part of this group. I look forward to the engagement of the coalition, to working with you individually and collectively. And I know that together we can make this a reality. Thank you so much for your time, your attention. And if you continue to put the questions on the group, we'll take note of them. My apologies for not having any time for the question and answer session, but I'm sure that there'll be plenty of time for us to engage on that otherwise. And with that, I believe we come to the close of our session. Have a good day, everyone.
Thank you.
Adios. Au revoir.
Gracias, gracias.
Muchísimas gracias.
Gracias.
Hasta pronto.
Gracias.
Yeah, thank you. Bye.
Bye.
Hasta pronto, gracias.
Thank you so much. Bye-bye.
Bye-bye.
Gracias.
Thank you
Adiós.
to everyone. Thank you.
Thank you.